everybody? It's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. We're here at Pure Plastic Surgery, and we are going to talk today about the theme of the month. Yes, you guys may have noticed that now in July we are talking about, or mostly about, tummy tucks. And of course, the tummy tuck is also a big part of the mommy makeover, so it's involved in that conversation as well. And we have our promo going on for the month of July, which is that if you book a tummy tuck or something with a tummy tuck, such as a mommy makeover, then we're going to throw in that Exparel for free. All right. What is Exparel? Well, that's the injection that we can give you at the time of the tummy tuck to make sure that you have less pain for up to 72 hours. So we inject it along the muscle plication, along the incision, and it gives you pretty good pain control for up to 72 hours after the case. All right. So I highly recommend the Exparel. And if you book a tummy tuck now in July, we're going to throw that in for free. Okay. All right. So I'm going to talk briefly about the different kinds of tummy tucks, and then of course I'll be happy to get into all your questions. All right. So these are really the main categories of the tummy tuck. So we have the mini tummy tuck, the full or your regular tummy tuck, then we have the extended, the fleur-de-lis, and nowadays a little bit more popular than it used to be, the reverse tummy tuck. So I'm just going to kind of briefly go into each of these, and then of course we'll get into the questions. All right. So what is the mini tummy tuck? So a lot of people, it sounds good, right? A lot of people are like, Dr. Earl, I want a mini tummy tuck. Can you do that for me? Right? The problem is that most people do not qualify for a mini tummy tuck, all right? Because the mini tummy tuck is a skin-only procedure, okay? It does not involve the umbilical transposition or moving the belly button. It does not involve the muscle repair or plication. And really all it is removing that little bit of excess skin below the belly button, okay? That's really what the mini tummy tuck is. So it's a skin-only procedure, and specifically only the skin below the belly button that gets removed, the excess skin there. And the incision is not that short. It's still going to be, even though it's called a mini tummy tuck, the incision is still going to be longer than your typical C-section scar, okay? So that you also have to keep in mind. Yeah, sure, it's going to be shorter than your full tummy tuck incision, but it's not like a little tiny incision. It's actually longer than your C-section incision, okay? But that is the mini tummy tuck. So if you have, a lot of excess skin or any excess skin above the belly button, you're not going to be a candidate. If you have weakness of the muscles or separation of the muscles, you're not going to be a candidate. What else? If you have a lot of excess skin just everywhere, you're not going to be a candidate. So again, that's why most people don't actually qualify for this procedure, even though it sounds good and a lot of people are asking for it. All right, but really most people qualify for your regular standard full tummy tuck. This is the one that most people qualify. If you had a baby, 2, 3, if you had some significant weight loss, this is most people are going to qualify for. And that's your regular tummy tuck. So that means, of course, we're going to be removing all the excess skin, but we are going to be doing that muscle plication. We are going to be doing that umbilical transposition, meaning that we have to create a new opening for that belly button to come out, and therefore you're going to have a little scar around the belly button as well. Where does the incision go? It typically goes from hip to hip. So if you feel kind of your little hip bones here in the front, that's your usual incision. It's going to go from about hip to hip. Sometimes it may extend a little bit further out, but that's your typical full tummy tuck incision from hip to hip. All right? And also, of course, with all of these, it involves a certain degree of liposuction, typically to the flanks and the waist, to kind of bring out that curvy figure. Remember that here in Florida, we are limited as to how much liposuction we can do with the tummy tuck. And so the max that we can remove via liposuction when we do any sort of tummy tuck is 1 liter. All right, I'll put that one here, but 1 liter is the max that we can remove when we're doing a tummy tuck, okay? That's why I don't, it's one of the reasons actually why I don't like to combine a tummy tuck and a BBL, all right? So if you need both, I highly recommend doing your tummy tuck first and then coming back 3 to 4 months later to do your BBL, all right? So that's your tip, yes, your full tummy tuck. Next is the extended. The extended is very similar to the full. You still get your muscle repair, right, your plication. You still have your umbilical transposition, so you still have a little scar around the belly button. You still get your 1 liter lipo, but the only difference there is that the extended tummy tuck is that it goes around the corner, right? So now we're not just going to like the little hip bone, but we're going around the corner towards the back, and we're extending it towards the back, okay? So that's the extended one there. Of course, it takes a little bit longer because we have to do bigger incisions and remove more skin. But these are typically more for like the massive weight loss patients. They usually need an extended tummy tuck there, okay? Now, it does go around the corner towards the back, but it does not connect in the back, okay? If you bring it all the way around, then that's called a circumferential body lift. And that's, a different kind of bigger surgery altogether, okay? All right, so now we got the mini, the fully extended. The next one is what's called the fleur-de-lis. Again, this one's also typically for the weight loss patients or massive weight loss patients, because that's when you have not only excess skin kind of in this direction, right, but you also have excess skin in this direction. So you have it both in the vertical and horizontal plane, excess skin going in both directions. And so if you just pull the skin down, it doesn't work as well because you still have some loose skin in the middle, okay? And so that's when the fleur-de-lis comes in. With the fleur-de-lis, it involves not just the incision that's going along horizontally along the bottom, but also an incision that goes vertically from all the way from the chest to the pubic area. So you have the horizontal one from hip to hip, plus an additional incision that goes from the chest to the pubic area, okay? And so that is, of course, a bigger surgery there. It still involves the muscle plication as well, or the muscle repair. It still involves, of course, a scar around the belly button, and it involves the longer vertical scar from the chest to the pubic area. And so that's your fleur-de-lis tummy tuck, like I said, reserved mostly for massive weight loss patients. And then last but not least, because it's gaining more popularity lately, it's what's called the reverse tummy tuck. So now the incision is not down here, by the hip area, but it's going to be up here underneath the chest or underneath the breast. Okay. So instead of pulling down, we're now pulling up. Okay. But typically with this one, keep in mind that it is usually a skin-only procedure as well. It does not involve the scar on the belly button, and it does not involve the muscle repair. So if you just have some excess skin in the upper part of the belly, but you have pretty good muscles, muscles that are pretty close together, pretty tight, then you could be a candidate for the reverse tummy tuck. You know what I've seen more and more now is that someone who decided like they didn't want to do their tummy tuck first and they did their lipo 360 or BBL first, and maybe they got some Vaser or Body Tight, and that helped. And it helped kind of tighten things up around and below the belly button. For whatever reason, they were left with just a little bit of skin laxity in that upper abdomen. Then those are typically good candidates for a reverse tummy tuck. The other people that are good candidates are those that already have a breast lift, because it's the same kind of lower incision just underneath the breast in that inframammary fold. Okay. Now, the reverse tummy tuck can be done kind of in a mini style, where the incision is just underneath the breast, but it does not connect in the center. Or it can be like, your regular reverse tummy tuck, where the incision is underneath the breast, but it has to connect. So it goes all the way across, connecting in the center, and then going along to the other side, okay? Now, that's something you have to take in consideration, because if you're going to wear like a bikini or a low crop top or something like that, that little scar that kind of goes across from one side to the other may be visible, okay? All right, so that's it. Those are all the types of tummy tucks that you could possibly get. How do you know which one? Well, the best thing is to get an evaluation, right? So you can go to our website, www.pureplasticsurgery.com, go to where it says virtual consultation. There you can send in your questionnaire and your photos, and then based on that, we can make a recommendation as to what will be the best tummy tuck option for you.
Okay, and there's an important question about that.
Yeah.
Can you still come for in-person consultation versus the virtual?
Yeah, of course. So we have 3 types of consultations here, right? You can do what we call the virtual consult. That's the one that you do completely online. You fill out the questionnaire, you send the photos. Each of the surgeons, depending on what surgeon you're choosing here at Pure Plastic Surgery, will evaluate that, and then one of our coordinators will get back to you with recommendations, okay? And that's still actually typically the easiest way to get started. Now, if you want a video consult with myself or one of the surgeons, and that's available too. So that's option number 2. And then option number 3 is an in-person consult, and so we can do that as well.
Okay. Can you do a reverse and breast lift in one surgery?
You typically can. So that is something that we can combine. So you can do your breast lift and your reverse tummy tuck in one surgery. And like I said, the incision can be very similar to the lower part of your anchor type incision. So the incision that goes along that inframammary fold. So you're not going to have 2 incisions there. Even though you're combining it in one surgery, you're just going to have the one incision underneath the breast.
Do you do ab etching when doing liposuction?
Yeah, certainly. So ab etching is something that can be added to your lipo 360 or liposculpture procedure. It can also be added to your BBL. Again, you have to be a good candidate for that. So typically these are patients that are a little bit lower on the BMI range, so not maybe anywhere from BMI from like 21 to 24, maybe 25, depending on your body structure. But yeah, typically a patient's going to be lower in the BMI range, looking for that athletic look. It can be tailored, of course, both for men and women. Men typically want like the full-on six-pack look, which can be achieved, and women want more like that feminine, athletic look.
And it could be done, I guess, the ab etching with a tummy tuck?
So it's tougher to do like a full-on ab etch with a tummy tuck, okay? What I can tell you though is that if you have a tummy tuck and you then come back for your liposculpture or BBL, then it can certainly be done at that time. So you're not burning a bridge. But to do it all at the same time can be tough. It's certainly not the etching where you're like really defining the six packs. You can do some soft etching at the time of the tummy tuck, where you kind of define a little bit of that central line, a little bit of the lines on the side, a nice kind of soft etch athletic look, but not like the hard etching.
Doug, can you do a belly button revision only without the tummy tuck?
So you can. It depends on how, on the belly button and how much it's got to be done. If it's just kind of like a scar revision, it's typically possible. Now, sometimes we get these belly buttons that are like a little bit flat, like they're a bit too raised. And in order to really revise that type of belly button and kind of make it more of an innie, then unfortunately you have to go back through that tummy tuck incision and kind of lift everything up and really kind of tack the belly button down to create more of an innie look. So it depends on what type of revision you need, how extensive it has to be. In some of them you can do it like pretty simple under local and just around the belly button. But in others you have to maybe do something a little bit more complex and actually open up the entire tummy tuck incision, to really bring that belly button in.
Okay, a well-known practice in Texas has introduced the Dominican tummy tuck as the new standard. You have thoughts about it?
I don't know exactly what that means. I think, I don't know what they're calling a Dominican tummy tuck, to be honest. These are the types of tummy tucks, so I assume it's one of these types. I'm not sure what makes it Dominican.
How long after having a baby should you wait to have Lipo 360 HD Lipo and also breast lift augmentation if you are not breastfeeding?
If you're not breastfeeding, okay, so that's good. If you're not breastfeeding, you want to wait 6 months. So you want to wait 6 months for your body to kind of bounce back, and perhaps you're going to lose a little bit of weight, which is not unusual after giving birth. So you want everything to kind of settle down again before then you go into surgery. So 6 months would be adequate. Now, and I know you mentioned which is good, but if you are breastfeeding, remember it's a little bit different, because if you are breastfeeding, you want to wait 6 months after you stop the breastfeeding to do a breast procedure. Okay? So if you are breastfeeding, you need to, once you stop breastfeeding, then you wait 6 months in order to get your breast procedure.
En español.
Vamos.
Tengo
Okay.
44 años. ¿Soy candidata para un BBL?
Sí, Sí, 44 años estás perfecta. Para mí la edad máxima es 50. Para algunos otros cirujanos acá en Pure la edad máxima es 55. Pero ciertamente 44 años no hay problema. Ok, suponiendo de que estás bien de salud y que no tienes ningún otro problema médico.
Okay, after a mommy makeover, if you have more weight loss after, what's the next thing to do?
Right. So ideally, you would be at kind of your ideal weight or stable weight before you do your mommy makeover, right? So if you're a weight loss patient where you're losing weight via diet and exercise, via the injectables like Ozempic or Mounjaro or bariatric surgery, you want to get down to that stable weight first, right? It doesn't make sense to kind of do your surgery in the middle of your weight loss journey because then you're going to lose another significant amount of weight and then your results are going to suffer. Okay, so that's really the most important point there. So get down to your ideal weight, your stable weight. Once you're there and kind of that weight loss line has flattened out, then go ahead and do your surgery. Okay. Now, if you're, whatever, if that ship has sailed and you had a mommy makeover and you lost a significant amount of weight and things have become loose again, well, then we'll have to do an evaluation to see what we can do to kind of help things out. I've had patients where you can actually kind of do the whole thing all over again because they've lost that much weight that now they can do another tummy tuck and another breast lift. So that's a possibility. So there are options there depending how severe the skin got loose again, right? So if it got just mild, maybe mildly loose, then maybe we can do something like Morpheus 8, right, in the clinic, right, where we can just do the Morpheus and that'll help tighten the skin up a little bit. If it's moderate, maybe we can do something like using the Vaser or the Body Tight to help the skin retract a little bit better. And then of course, if it's like moderate plus to severe, then it's going to be another surgery where we're removing excess skin.
Okay. How long to do a reconstruction to a tummy tuck due to a necrosis and to do lipo?
Oof, that's gonna be a tough case. So that's gonna have to be taken on a case by case basis because if you've had, I don't know exactly the extent of the necrosis, if the skin died or what exactly happened. So I would have to have more information to know exactly what could potentially be the next step in order to try to help the patient.
Okay. Can a loose skin get better with a BBL?
So it depends on how loose the skin is, right? If you have, like I said, if you have like a mild to like low moderate skin laxity, then some of these devices that we use can help, such as the Vaser or the Body Tight, okay? Now, if you have from like moderate to severe skin laxity or loose skin, then these devices are not going to be powerful enough to help, right? They can only do about 50% of what the cutting surgery could do. So if you have moderate to severe skin laxity, for example, in the belly area, then I recommend doing your tummy tuck first and then coming back 3 to 4 months later and doing your Lipo 316 BBL. And the good news is that once everything gets really, really tight, for the right candidate, you actually can go back and do like liposculpture and high definition lipo and ab etching and things like that.
I have so many good questions, Doc. For real.
Yeah.
Why is BMI such an important factor when it comes to plastic surgery?
Great question. It's a great question because it's not fully understood, and sometimes people get upset when they don't qualify for surgery because their BMI is too high. So there are multiple studies that have demonstrated that the higher the BMI, the higher the complication rates. Okay, and these are complication rates that can range anywhere from wound opening to infection to like even more dangerous stuff like blood clots. Okay, blood clots, which are your deep vein thrombosis, the ones in the legs, and the ones that go to the lungs, the pulmonary embolism, which can be potentially fatal, right? So the higher the BMI, the higher the complication rate. And so what we're talking about here, we're talking about aesthetic or cosmetic surgery, which is purely elective, right? So it does not make sense to, you have to have the risk-benefit ratio needs to be there. It can't be too risky, and so you have to put a limit on the BMI. So for example, for me, my max BMI limit is 30. Other surgeons may go a little bit higher. I certainly do not recommend that anyone have a completely elective cosmetic procedure with a BMI of 35 or higher. I don't think that's safe to do.
Okay, and this is like part of that question, but she says, and why are surgeons out of the country able to operate on higher BMIs?
They do it, and the patients need to assume the risk. And theoretically, I guess at least I would hope that they're at least telling the patients that it is a much higher risk in terms of complication rates, potentially blood clots, and even death. And that is also the reason why in certain countries, in certain clinics that accept these high BMI patients, we see more deaths and more complication rates. So it's not because it's any safer somewhere else. So I wouldn't recommend doing any sort of elective procedure with a BMI of 35 or higher anywhere in the world. I'm not just talking about here at Pure. I'm talking about anywhere in the world.
What made you pick plastic surgery as your specialty?
Oh wow, okay, philosophical question. So the reason I chose plastic, it wasn't like, oh, it was meant to be, or I always wanted to do this since I was a little kid. It was actually something that kind of evolved through time. But I always knew I wanted to do medicine, and within that I wanted to do surgery because I do like to work with my hands. I like to do procedures. And when you get into your general surgery program, you start rotating through the different specialties. And what I noticed when I was rotating through the plastic surgery specialty is that it's the only surgical specialty where you're actually putting things back together again, where you're restoring form or function, right? All the other surgeries, because you have to, for whatever reason, you have to destroy something, right? You got to pull out the offending organ, you got to pull out the tumor, you got to cut out the cancer, cut out the liver that's not working. You got to cut off the limb and get doing an amputation, right? You have to remove something in order to help the patient so that they can live, right? But the only specialty that then goes back and not thinks just about life or death, but thinks about quality of life and restoring form and function is plastic surgery, and that's what drew me to this specialty.
Okay, can you get fibrosis on muscles or skin from? Okay, I don't know what you tried to ask, Doc. I think we're going to the next one. Sorry.
Okay.
How long after a tummy tuck for a 360 lipo with BBL?
Right, so I recommend 3 to 4 months, and I think that is the perfect way to do it. You want to do your tummy tuck first, get that excess skin all removed, tighten up those muscles, get things as flat as possible, and then come back for your lipo 360 or BBL 3 to 4 months later.
Okay, now I got the right question.
All right.
Can you get fibrosis on muscle or skin from a plication?
I don't typically see fibrosis from your plication. No, I've actually never seen that. No, fibrosis, you get it mostly from liposuction, and it's not at the muscle level. It's at what we call the subcutaneous layer, so just beneath the skin. So it's kind of like just beneath the skin, and that fatty layer that's between the skin and the muscle. That's where you typically see fibrosis, and it's usually due to liposuction.
Can you explain about the ultrasound technology that you use during a BBL and why that's important?
Yeah, so, well, first of all, thank you for that question. I think it's incredibly important. I think we talked about this maybe 2 weeks ago or so when we're going over like different things on how to choose your BBL surgeon. And I said like the only one that was completely non-negotiable is that they must use the ultrasound imaging for guidance when transferring the fat in the BBL, okay? I've been doing this since 2019. I've done over 2,000 ultrasound guided BBLs and I've never had an issue with fat embolism. And so why is it so important? Because when you basically you're turning a blind procedure from one where you can actually see, okay? So now with the ultrasound imaging, you can see exactly where the device is that you're using to place the fat. We call it a cannula. So you can see exactly where that cannula is. You can make sure that it's in that safe space between the skin and the muscle. Okay? And then you can make sure that you're placing that fat in that safe space, and therefore the risk of a fat embolism or death becomes very, very low. And so that's the way that I think it should be actually standard of care in the U.S. and throughout the world when doing a BBL.
Okay, Doug, could you please explain the BMI requirement again in a sad face?
So every surgeon is going to have a different BMI requirement. But for example, for me, my max BMI is 30. Okay. Other surgeons may go a little bit higher, 32, 33. I think that's, it's still reasonable. I think anything that's 35 or higher is not reasonable. I think once you start getting into BMIs of 35 or higher, the risk is too high for a completely elective surgery. That's what we do in cosmetic or aesthetic surgery, right? It's completely elective. It's not like a life-saving surgery that you absolutely need at that moment in time, right? So you can lose the weight. You do have time to get better optimized for your surgery to make it less risky for you, to make sure that you do well and that you enjoy your results and you get back to your family and your kids, right? So as the BMI goes higher, like I said, the complications rates go higher, and it gets to a point where it's just unacceptably high. And I think that point is about BMI of 35 or higher. It's just unacceptably high, and I don't think anyone should be having elective surgery with a BMI of 35 or higher. I do keep my BMI to 30. I think overall I just get better results. Better long-lasting results is what we're about here. I like to provide beautifully enhanced, natural, long-lasting results.
Is it possible to do fat transfer to just the hips with Lipo 360 to improve hip dips? If so, is that still considered a BBL?
So it's definitely possible. I mean, it's considered a BBL just because BBL is just kind of known for like liposuction with fat transfer, right? But I mean, is it really a BBL? Probably not, in the sense that you're not transferring any fat to the buttock itself, just to the hip area. So that's really all about the nomenclature or the names. But if you want to be technical, then what is it? Well, it's a liposculpture 360 with fat transfer to the hips. And you can tell that to your coordinator, whoever you're looking for to get a quote, and then they'll quote you appropriately, excuse me.
Okay, well, you will be my doctor soon. I have a friend that made a surgical procedure with you, and she's more than perfect now.
Awesome. All right, I'm looking forward to it. So I look forward to seeing you soon.
Okay. Doug, can you get a regular BBL after an intramuscular BBL?
Okay. So that's a very good question. The answer is yes. Can you do it? Yes. Obviously we're assuming that you had your intramuscular BBL, and thank God you did it well and nothing bad happened. And now, if you're gonna you want to do a little bit more, you want to get a little bit more volume, you can do, what's today's standard of care BBL, which would be a BBL under ultrasound guidance, placing the fat in the subcutaneous space. With the ultrasound, you'll still be able to see the different layers. So you still should be able to see the layer that's between the skin and the muscle, and still be able to place the fat in that safe space, even though fat have been placed underneath there in the past.
Okay, I have high D dimer. What should I do in order to get a BBL?
Well, unfortunately, most people with a high D dimer have increased risk of blood clots. And so you would not be a candidate, at least not for me, for BBL here in the office-based surgery setting.
Okay, and the last question, why do you require to wait 6 months after pregnancy for BBL or lipo?
So you want to wait 6 months because you want to give the body a chance to really bounce back after the pregnancy, right? And so it takes a while to do that. It's not immediate. Your body's been through a lot. Okay, you've gone through 9 months or 40 weeks of pregnancy. Associated with that are many things, you know, expansion of the muscles, of the skin, weight gain, etc., etc. So your body's gone through, you know, hormonal changes as well. So your body's gone through many, many things, you know, with the pregnancy, and we got to give it adequate time to kind of bounce back from all that and kind of settle that down into a stable state before you then, you know, continue with a surgery. Because at the end of the day, like I said, you don't want to be doing surgery like every year, right? You want to be doing surgery in a way where you can, you know, potentially be able to enjoy the results for as long as possible. So in order to do that, you have to start off at a stable place, right? So that you can get consistent results that will be a beautiful, enhanced, natural look that will be very long lasting. All right. Okay. Some great questions today. I like that. Very, very nice. So thank you, everybody. I really appreciate that. And remember, it's Tummy Tuck Month here at Pure Plastic Surgery. You book your tummy tuck on its own or with the Mommy Makeover. You get your Exparel thrown in there for you, okay? Because who wants to have pain, right? All right. Well, I look forward to seeing all of you next week on Hump Day with Dr. Alex Earl. Take care, everyone. Ciao.